Well, hello and welcome, dear friends and colleagues, to another episode of Positive Psychiatry with Dr. Rakesh Jain. I'm, of course, Rakesh, and I'm delighted to have you with us today for a very special episode. And this episode is an exploration into the top 10 tips for clinicians to become expert practitioners of positive psychiatry. I think this is a very meaningful conversation, and we have a special guest with us. And before I introduce the special guest, please know I really thought long and hard about who to invite, who's done the most work in this area, and immediately the name that came to mind was Dr. Saundra Jain, who's an adjunct affiliate at the University of Texas School of Nursing, as well as in private practice. And she has been working in this area for well over a decade and a half. So we're going to really leverage her knowledge and her education. So Saundra, having said that, welcome to the podcast, and perhaps you might want to take a minute to say hello to our listeners and tell us a little bit about yourself.
Oh, I'd be so happy to, Rakesh. Like Rakesh said, I'm Saundra Jain, and the world of wellness, whether it be in clinical practice or just in regular day-to-day living, is really a heart passion for me and Rakesh as well. But this is a mainstay part of my work and daily living. I'm absolutely thrilled to be here with you today, Rakesh, and all of your viewers. You know, as I thought about our conversation today, this journey, it's not just theoretical, it's not academic. It is practical, actionable, and oh my goodness, it is so deeply relevant to all of us. And honestly, that's whether you're a psychiatrist, a psychologist, a therapist, nurse practitioner, social worker, or hey, how about just a curious learner? We believe that this episode, this very conversation, will expand our practices and uplift our perspectives about wellness. I couldn't be happier to be here today.
Well, thank you very much. I certainly appreciate you being here, and I'm sure our colleagues do too. And let's perhaps level set here, because positive psychiatry isn't a denial of suffering. It's in fact a deep acknowledgement that healing includes growth and meaning and resilience. It's so much more than simple symptom reduction. And these top 10 tips we're about to share with you, they're all in fact based in science, our experience, and I have to say, we genuinely believe in them.
You're so right, Rakesh. So together, we want to invite all of you. Settle in. You may want to grab your journal, or you may want to take a walk while you listen. However you like to learn, this episode is just for you.
That's wonderful, Saundra. So let's begin with tip number 1. So tip number 1 is foundational. It is the following: adopt a wellness-centric mindset. This is absolutely foundational, dear colleagues, because the art and practice of shifting from a problem-centric to a wellness-centric mindset is important, but it's not all that easy to do. Most of us have been fairly indoctrinated in the problem-centric practice because that is traditional psychiatry. We often focus on what's wrong. We rarely ask what's strong. Let me say that again. We focus on what's wrong, Saundra, and we don't often ask or focus on what's strong. So what do you think about that?
Oh, I got so excited, Rakesh. I just stepped right on your words, because what I was going to say is I love the practice of asking people what's strong in your life. And, I think it's important that we share with everyone that our greatest teachers about wellness have been our patients over these many years. And we learn from them that this really, like you said before, is not the pursuit of ignoring illness, but it's really the practice of holding both suffering and strength in the same clinical space, in the same conversation. We could even say we can hold both in both our hands because we can truly recognize pathology, illness, whatever we want to call it. And at the same time, we can promote and enrich growth, purpose, and really true vitality and flourishing.
Well said, Saundra. Because here's the thing, patients want to flourish, not just function. And that is something we've discussed in previous podcasts. The research is quite convincing on this. Patients want to flourish, not just function. So when we adopt a wellness orientation, we in fact invite our patients to dream, to hope, and of course to build.
Yeah, and as I'm listening to you, Rakesh, what comes to mind is I'm remembering patients, and sometimes that can feel like a lot, or it can certainly feel unfamiliar. So I believe it's important to start with small changes. Sometimes we call that baby steps. We ask about the meaning in their lives. We can even acknowledge progress along the way and begin to incorporate wellness into every single treatment plan. Because if we're honest, a treatment plan without wellness, it's just incomplete.
Well said. Well said. And perhaps this is time for me to admit that for decades of my clinical practice, wellness actually never figured anywhere in my thinking or in my recommendations. But I would say maybe in the last decade and a half, I've really come to recognize that our patients really do want more. So that is tip number one, dear colleagues. Tip number one is our mindset. But it does set the tone for everything else that follows. Well, what is tip two, Saundra?
All right, let's dive in. Tip two is incorporating strengths-based interviewing into every single patient encounter, every conversation.
Okay, let's be honest. Most clinical interviews that I've ever conducted start with, "What brings you in today?" Or "What's wrong?" But what if we instead asked, "What gives you meaning? Tell me one thing since I've last seen you. What has gone well? Tell me one thing since I've last seen you a few weeks or a few months ago that you really enjoyed." I don't think, Saundra, that at all discludes or, puts down their suffering if they have any sets of symptoms. But I think it completely changes the tone of the conversation to start the clinical interview the way one might with a friend. I mean, if I meet a friend, Saundra, I don't necessarily want to hear, nor do I ask questions, "What's wrong?" I often say, "What's good? What's been happening? Tell me something good that's been going on in your life." So perhaps we could do that. What do you think? Even in our clinical interviewing.
Yeah, I love that, Rakesh. The one thing that I often ask people is this: what's the most exciting thing you've done since we've last met? And I have to say, as I've begun to incorporate that into my language, people are kind of shocked by that because they're waiting for me to ask them, "What do you want to talk about today?" Right? So really looking at what's exciting. Rakesh, I know you're familiar with VIA character strengths, but some of those joining us today, they may not be. So let me take just a minute and explain that. The VIA classification, it's a framework that was developed really by the godfather of positive psychology, Dr. Marty Seligman and Dr. Chris Peterson. And their goal was to identify and measure core human strengths, all the things that contribute and really build and nourish a meaningful and really fulfilling life. So things like curiosity, kindness, perseverance, compassion. And these really can help our patients serve as, I guess we could call it a clinical anchor, but to ground them. And I know this true, Rakesh, that you and I have both seen this in the people that we've worked with over these many years. Honestly, they light up when we help them rediscover their strengths.
Yeah, and while that may seem like a lot to do in a med check visit, perhaps, or a psychotherapy visit, here's an expert tip that I got from you, Saundra, which is just one single strength based question during one particular interaction with a person is enough. And maybe I can give you an example. Yesterday, I was meeting a 31-year-old who is going through some very rough times. And I asked him, because his signature strength is perseverance. He really holds himself and his ability to stick it out as one of his great strengths. And I made sure that he and I discussed his previous strength, that we still find it even as he's going through his difficult times, and a recognition that I admire him for his strength-based approach to life. It, Saundra, radically changed our conversation about a discussion of his mental health challenges, because such conversations open doors.
Yeah, I believe when we do that, Rakesh, it really is an opportunity for the person that we're talking with to really feel seen and heard and acknowledged. And honestly, when we do what you just described, look, we're no longer just gathering data, but we really are nurturing hope for those people. And that absolutely is a beautiful thing.
Wow. Let's end this tip by me repeating what you just taught us. Because when we talk about strengths, right along with the weaknesses and challenges the person is experiencing, we're not just gathering data, but we are nurturing hope. Thank you so much. Now let's transition to tip number 3, which is integrate positive interventions into treatment, no matter what the treatment might be. Pharmacotherapy, psychotherapy, combination. So tip 3 is about action, integrating positive interventions into your clinical work.
Well, think about this, Rakesh. We as clinicians, we are evidence-based. We want to know what's been proven. And these practices, they are scientifically validated exercise. Things like we could do gratitude journaling, a simple act of kindness, or future visualization, like a practice in visualizing the next best version of yourself. And we said it earlier, but I think it's worth repeating. These are small practices. These may be baby steps, but my goodness, they are mighty in terms of improved outcomes.
No doubt about that, Saundra. Gratitude is one of those gifts that never stop giving. They really don't. And I think we ought to be teaching our patients about that. So for instance, there's a practice that you and I have actually talked about both in our clinical work, but in our professional teachings of individuals, called the 3 good things practice, which is writing down 3 positive things that have happened each day to the person. While that may seem incredibly small, Saundra, I think you and I would join forces in reassuring our listeners that doing this even for one single week, just 7 times, has shown measurable effects on improved well-being and decrease in depression.
Absolutely. And one thing I'll add that I've learned in using this practice with my patients is this. I almost always ask them to do it in the evening each night before they go to bed. Now, they may decide not to do that, and that's perfectly fine. But here's my reasoning behind that invitation to do it at bedtime. Usually at night when people settle in, the lights go out, it's the time when the rumination and the worries tend to creep in. And so if people can end their day on 3 good things, it's a little bit of a buffer, a way to push back some of the ruminative thinking and drift into sleep with these 3 good things that happen during the day. And Rakesh, you're so right. I mean, we really are trying to practice what we preach, and we have done this exercise. And exactly what you said, it is a boost to well-being. And if mood isn't great, it also lifts mood. So in some ways, it's like assigning these practices a little bit like emotional rehab, if you will, or a prescription for really building inner strength and resilience.
Got it. That is beautiful. So that shifts us to tip number 4, which is, well, I'll let you talk about that, Saundra.
Well, it's what we mentioned earlier. Tip 4, I mean, it is all about hope that's rooted in science. Now, let's see if this sits well with you, but we're going to invite you to educate your patients about neuroplasticity. I want you to know I've seen it work time and time again, because once folks learn that the brain really can change, it instills a sense of hope in them, and they will begin to change. They will begin to follow through with all the prescriptions for wellness that we're offering to them. That sense of hope is magic.
Yes, when we tell our patients, your brain can change, that may sound like just a throwaway comment, but, the fact is, it's actually true. We're giving them more than information. We're giving them the possibility of change, right?
Absolutely. And I want to tell you, and for all of those with us today, this is how I do it. I show them simple images of how practices like mindfulness or behavioral activation, behavioral practices actually alter neural pathways. I'll use metaphors like, it's like muscle training or physical therapy for the brain. And those kind of metaphors really resonate with folks.
Yeah, and also love the fact that we can frame setbacks that our patients have as part of the growth process. That really is positive psychiatry. Positive psychiatry is not a fake, vaporous, everything is okay and everything will be all right. It even accepts that setbacks are part of the growth process, and patients then stop seeing themselves as broken. They start seeing themselves as becoming. So
beautifully stated, Rakesh. I mean, that's worth saying again. They're not broken. That's beautiful.
And they're becoming.
Yes.
They're becoming. So a psychopharmacologist who's listening to us might say, but my job is to know side effects of medications and what dose to prescribe. And I would say this, Saundra, as a psychopharmacologist myself, absolutely. We do need to be true experts in our medications. But perhaps the question to ask ourselves might be, don't we need to first be experts in people? And if we are experts in people before we're experts in psychopharmacology, then perhaps we should help our patients stop seeing themselves as broken and start seeing themselves as becoming. Now we move on to tip number 5. My goodness, I'm really liking this conversation, Saundra, and I am I'm pretty convinced that our listeners are also feeling the same way and appreciating your expertise. So tip number 5 is making meaning a clinical priority, because meaning making is not fluff. It's medicine. That is an important tip, right, Saundra?
Oh, absolutely, Rakesh. I mean, we sometimes as psychotherapists are accused of being a little too touchy-feely, a little too woo-woo, but honestly, this is a relational transaction between two people, and it's not fluff. It is healing. And one of the ways over the years I've learned to really amplify, highlight all of this work is by integrating things like existential tools, definitely somatic practices, pulling in what we talked about earlier, the values clarification, and narrative therapy, because it really does help people connect their story to something much deeper. We kind of move not away from, because we still want symptom reduction. We're not throwing the baby out with the bathwater. We're still doing that, but we really are digging into meaning making and something much deeper.
Yeah, I've noticed that even in depression and perhaps even in deep, deep grief, meaning making of one's symptoms that, of course, we clinicians would help a patient understand, it can actually come shining through. And just in the last week, I met a lady who sadly lost her spouse and went through a horrendous weekend. Horrendous weekend. But she converted with some help from me at looking at it not just as horrendous pain, but horrendously important need for remembrance of what she had lost. So as she came out of it from the other end, we stopped looking at it just as DSM-5 symptoms, but looking at a human who was mourning the loss of her spouse and recreating a life that she had completely lost. So when we help patients locate that meaning, we are accelerating recovery, right?
Oh, so beautifully described. And I'm really feeling that the woman that you were helping really benefited from the conversation, because what you're pointing out is by doing this, we begin to build and nourish this relationship person to person, and that becomes the anchor. That becomes what grounds them as they walk through, like we all walk through challenges in this life. Well, we are at the halfway mark, Rakesh, if you can believe it. Out of our 10 tips, we've just completed 5. So how about we do this? Let's pause for a moment. I'd like to invite everyone to simply take a deep breath in and then slowly exhale through the mouth. You may want to stand up and stretch, walk around a little bit, and reflect on what we've talked about so far. What's landed with you? What's really resonated?
And maybe even journal a line or two. In fact, very often when I'm listening to podcasts, Saundra, I'll often journal on my smartphone, on my notes, and then reflect upon it. So I encourage our colleagues to, think about what we've been discussing and see how it applies to you. And then let's now return maybe for 5 more tips. What do you say, Saundra?
Yes, I'm ready if you are, Rakesh.
I am, and I'm going to cover the last 5 tips pretty quickly with your help, Saundra. So tip number 6 is addressing lifestyle as psychiatry. So psychiatry should no longer be seen as a specialty that only takes care of symptoms, but of people with symptoms. And that's why addressing lifestyle is emerging to be one of my favorites. Treat lifestyle as the primary psychiatric intervention.
Well, and Rakesh, there are so many options that we can draw from. Let me just run through a couple. We can pull from physical activity. Now, sometimes that pulls up exercise. People may not be wanting to do that. So we can soften it back a little bit and just call it movement, walking around the block, standing up and stretching, sleep hygiene, or simply resting periodically throughout the day. How about community and social connection? We talk a lot about nutrition, eating clean. I love the language of nourishment, because nourishment is not only for the body, but for the mind, the soul, and the spirit. And honestly, these practices are as vital as any medication a clinician can prescribe.
That's so true. That is so true. Instead of saying to patients, for example, did you get 30 minutes of exercise a day to help with your heart health or your mind health? Perhaps if we are followers of positive psychiatry, we could rephrase that by asking, when was your last joyful walk? When was your last meaningful conversation with someone you had met for the very first time? This radically changes the way people look at lifestyle, doesn't it?
Well, in the language about asking about when was your last joyful walk, it just softens the entire experience and really invites people into the experience. So, honestly, these kind of simple changes really can become catalyst for deep transformative healing. All right, Rakesh, we're at tip 7. Let's go. Hope is not passive. It's a skill that we can teach and learn.
Thank you, Saundra. Thank you for reminding me, reminding our listeners, maybe even our patients, that hope is not something you have or don't have. It's actually a skill that you can learn. And Snyder's hope theory, which focuses on goals, pathways, and agency, we can help patients visualize what they want, how to get there, and why they believe they can. The injection of hope into our conversation, into our patients, I think is as valuable as a long-acting injectable is, Saundra.
I love that. And let's remember, let's ask future-oriented questions. Sometimes we get stuck in the problem focus, but by future-orienting, we can help patients envision their future selves, what they desire.
Well said, Saundra. Well said. Now, it is clearly not our goal to give people false hope. So to perhaps tell someone with, let's say, bipolar disorder, that you are never, ever going to have another episode would be false hope. It'll come back to hurt the patient, hurt our relationship. But to give them the hope that with the right efforts, we can not only restore your functionality, but there's great reason to believe we can restore your wellness as well. And to have that conversation proactively is, I think, what you are saying. So reinforcing their capacity for hope, reminding them of past successes is just so incredibly important. And Saundra, tip number 8 is something you excel at. I got to see that in action maybe 30 plus years ago. And tip number 8 is build warm, authentic alliance. That is a foundational principle of positive psychiatry. So tip number 8 is simple but profound. Connect.
Yes.
Connect with your clients and patients with warmth and authenticity.
Yes, Rakesh, because the truth of the matter is that's all any of us want, is a connection with other human beings. So therapeutic alliance, just the fancy way of saying connection, that is a powerful agent of change. I mean, I'd go so far as to say it is the most powerful of all of them, being fully present, authentic, and human.
I love it, Saundra. I'm just going to flat out repeat everything you said so that it becomes part of my DNA. The therapeutic alliance is a powerful agent of change. And you said, Saundra, you go as far as to say it's one of the, if not the most powerful of all tools we can use in being fully present, being human. And what I would encourage my very busy colleagues, all of you, therapists, prescribers, people who do both, you're busy. Got it. But even in the space of a 10-minute, 15-minute connection with the patient, let's all use these micro affirmations, reflecting on the patient's strengths right back to them. Patients are strong. They sometimes forget it. They need to be reminded, right, Saundra?
Absolutely. I mean, Rakesh, this is the truth. When patients feel deeply seen and heard, acknowledged, healing happens. It actually accelerates. We've seen it happen time and time again.
Beautiful. When patients feel seen and heard, genuinely, human to human, you're completely right. Healing is accelerated and that relationship is cemented for life. You're so right. Well, tell us about tip number 9.
Happy to. You know, we are both big believers in measurement-based care. So tip 9 is all about tracking flourishing, not just pathology. Do both, but don't overlook well-being and teaching our patients about actually every week looking at how they're doing. Are they making progress? Are they struggling? That measurement-based care makes a huge difference in outcomes.
Yeah, lots of tools. Lots of tools are available. And if folks listening in are just like me, they have not been exposed to it in their formal training. And I get it. So down the road, we are definitely going to have an entire podcast devoted to the art of measurement-based care of positive psychiatry. So that'll be coming. But in the meantime, let me offer you just a few scales to consider and try them out, folks. The PERMA profiler, PERMA profiler. The second one is a scale Saundra and I have used quite extensively in our research practice, which is the WHO-5, WHO-5 wellness scale. Try it out. It's available quite easily from the internet. The brief resilience scale is wonderful. And there's a scale that Saundra and I have developed and validated called the HERO, HERO wellness scale. There'll be much, much more on that in future podcasts. So don't worry if you don't feel entirely comfortable with knowing about these scales, but you might want to start the process of getting more used to measuring not just illness, but also perhaps the level of wellness or its absence so that we can guide our patients in the right direction. Right, Saundra?
Oh, absolutely. Such a great suggestion, Rakesh. I mean, honestly, what we measure, we prioritize. And when patients know that we're prioritizing wellness, we're initiating and encouraging that conversation about wellness, they feel it and they're happy to continue the conversation.
You're dropping a lot of awesome zingers in this podcast, Saundra. What you said is what we measure, we prioritize. You are so right. And you're also right about what you said. When we prioritize wellness, patients not only feel it, they know it's a priority that they need to have. And if they need help, we stand by to help them. So perhaps making it a standard question to ask, how are you thriving since the last time I have seen you? Colleagues, you should just take my word for it for the time being until you try it out yourself. Just that very short 6-word sentence, if you start using it in clinical encounters, that being, how are you thriving this week? Just saying that will open up the floodgates to a whole new level of conversation we've never had with our patients. So we've covered 9 tips so far, and the final one is tip number 10, walk the walk, which is clinicians should self-practice wellness, that we must embody what we treat. What do you say, Saundra?
Absolutely. I mean, simply put, positive psychiatry begins with the practitioner. If we want our patients to flourish, we must too. And that suggestion of embodying what we teach, beautifully stated, Rakesh.
Yes, and you are certainly someone, over the last 3 decades I've seen, learn about this academically, and then you started applying it to your life. And as you started applying it to your life, it really seeps into your clinical encounters. And you know what? Patients really benefit. So folks, the message we're getting from our expert, Dr. Saundra Jain, is practice what you preach. Well, you might say, I knew that, but now we have clear direction that practicing what we preach on this issue will just benefit not just us, but our patients as well. So thinking about factors like gratitude, connection, feelings of awe, even movement and enjoying movement, let's make it our medicine too. We clinicians really are struggling quite a bit with burnout. And what Saundra is recommending, the positive psychiatry approaches, the 10 tips that we've talked about, aren't just good for our patients. They're in fact good for us.
Yes, and I would add one last thing, Rakesh, that our presence, how we show up, the one thing that we're in control of, how we show up, that is the intervention. That is the medicine.
Beautiful. There you have it, folks. 10 transformative tips in all of us becoming even a greater expert in positive psychiatry than we were yesterday. Thanks so much, Saundra.
I'm so glad to have shared this time with you, Rakesh, and hoping that this wasn't just information, a data dump, but that it really is and has been inspiring for all of us.
Yeah, I feel it is. I genuinely feel it is. And what I would encourage for our colleagues is to take one tip. Try one. Try it for this week. And then you got these 10 tips. And I'm certainly hoping you'll discuss it with your colleagues, because sometimes just the act of conversation about these issues with a colleague can really help. And Saundra, you said this before, that it's not about perfection. It's about practice and presence and intention and hope. Say more about that, will you?
Absolutely. I mean, I think, are trained to go to the treatment plan, the modality, the intervention. And if we just step back and really spend some time in terms of how we show up to these relationships. And I'll say this, not just in clinical practice, but in our life, in all of our relationships, showing up fully present and open and exuding love and hope, that is foundational to making change.
Yes, it is. And perhaps I will close out by doing two things, Saundra. First is to thank you. You were our first inaugural expert on this podcast, and boy, have you set the mark high. You are setting a very high level of expectation for all of us appropriately, that we need to be practicing these skills in order to not just benefit ourselves but our patients. And I will say this at the very conclusion. Look, to be a psychopharmacologist, if that's what you are, is to not limit yourself to just that skill set, but to expand it. And positive psychiatry is not for 1 second excluding the value traditional psychiatry brings to us, but what it does to enhance us and enhance our care better. So Saundra, maybe if you have any final words here, we would love to hear from you, and then I'll close it out.
Perfect. Well, first and foremost, thank you for the invitation, being with you and with the audience. Absolute pleasure. But until next time, my suggestion is keep practicing what's healing, what really helps all of us flourish and become whole again.
Beautiful. So until next time, dear colleagues, as Saundra said, let's keep practicing these positive psychiatry skills, because what heals is also what helps all of us flourish. Okay, folks, thanks so much for joining me on Positive Psychiatry with Dr. Rakesh Jain, and I will be talking to you later. Goodbye for now.